Hi, my name is Nemi Ramos and I talk about the abortion. What is abortion? Abortion is a procedure where you want to end constantly and ongoing pregnancy. Many countries are restrictive about these practices, which causes some women to resort inflammations or abortions in an illegal and insecure manner, seriously endangering their lives and health. What types of abortions are there? Are there two types? That is spontaneous or natural and induced. A spontaneous abortion is the loss of a baby in the first 20 weeks of pregnancy. About 10 to 20% of the pregnancies defected end in a miscarriage, and more than 80% of those losses occur before 12 weeks. And induced abortion is a voluntary termination of pregnancy. This practice consists of provoking the premature termination of the pregnancy, preventing the vital development of the embryo or fetus for its elimination. Symptoms of spontaneous abortion. The symptoms is bleeding or vaginal hemorrhage, abdominal pain, urinary contraction, vaginal discharge, nausea or vomit, cramping, fatigue, and irregular urine bleeding. This is usually the first symptom of miscarriage, that is symptoms of induced abortion. In 1/4 pregnant women loses some blood or finds stains on their underwear or toilet paper, and most of these pregnancies don't end in abortion. And the symptoms is excessive vaginal bleeding, persistent fever, vaginal discharge with a foul odor, vaginal discharge with appearance of pus, and abdominal pain or tenderness. Risk of having an abortion. A principal risk is age. Older women are more likely to conceive a baby with chromosome abnormality, and this type of pregnancy is more easily lost. Diseases and chronic conditions. Some of the conditions that may increase the risk of miscarriage are poorly controlled diabetes, inherent conditions that cause problems in blood clotting, immune system diseases, and hormonal conditions. Urine or cervical problems. Ascertained congenital malformations of the uterus, severe urine accessions, increases the chances of abortion. The relationship between urine fibroids and spontaneous abortion is controversial, but the fibroids do not cause problems. And the medicines, it has been shown that some medications increase the risk of miscarriage. And others risk, for example, infections and smoking, drinking, and using drugs. The abortion prevention. The medical plants is Gerald Artemis, Tarantula, and Foot of Lion, or Achinella as of the first trimester. Tisanes of leaves of raspberries and ginger. And the complements, that is vitamin B6, B12, E,